Welcome back. Here we have another episode of Klaus Off, where interventional radiology gets raw, unfiltered, and real. In this episode, we go global. We are honored to sit down with Dr. Mohammed Badran, President of Pan-Arab Interventional Radiology Society, and a true force behind the growth of IR in Saudi Arabia and border Arab region. First of all, thank you so much for me being a resident, being welcomed over here with wholeheartedly, the whole pace. I'm really grateful for that.
I'm grateful that you have joined us in the meeting.
Thanks so much. So, can I just ask you your early days in IR, what were the challenges that you were facing in building IR in Arab countries, and how things were in your early days?
Yes. I think early days were easier than later days, because in the beginning, interventional radiology was moving on. It was developing. We were exploring the things we are going to do, and people liked what we did, and there was no competition. Now that people have seen our success, everybody now wants to do interventional radiology because they have seen that it is the future, and everybody wants to join the future.
Yes, the other specialties trying to do that. Yeah, the challenge is there everywhere, right? Even in India.
It is the whole world, yes. The whole world loves what we do.
Yeah. How do you think, what can we do, to stop that? Prevent, we can't do that, but what can we do from our end?
The most important thing is training.
Yes.
Training is vitally important. For the patient, it doesn't matter who does the procedure. What matters is that the patient has a good result. So we have to focus on training. We have to focus on creating large number of interventional radiologists, because the more interventional radiologists we have, the better the chance for the patient to reach for the right person. We need to improve the clinical access to the patient. That means we have to create our own clinics. We have to advertise those clinics so that people will know who we are. They will know what we do. We have to be vital and present in every single hospital and actively provide our services so that not only the clinicians but also the patients and the public know what we do, so that they ask for us to treat them.
Okay, so coming back to that, do you think that it is necessary that we should include interventional radiology in the curriculum in the medical student time itself?
It is vital.
Yes.
Because when there is a medical student, he wants to decide what his career is. Conventionally, most students think medicine, surgery, pediatrics, gynecology. Now the world has become big. And our specialty has the potential to offer treatments in almost every discipline of interventional radiology. So I think it's very important that we actively seek medical colleges in every single country, so that not to test the students, but to tell them what we are. We make them entertained so that when they want to choose a specialty, they choose us.
So during the internship time and all, how it happens in India, so we have this postings in surgery, medicine, and we have this department-wise postings there. So ideally, during that time itself, the student should be posted in an interventional radiology department also for a month at least, right? To understand what the procedures are.
Correct, I totally agree.
Yeah.
They must, I think they must be involved, at least in seeing the procedures, in seeing patients so that they understand. And we should actively go and seek the medical colleges in PARS, Pan-Arab Interventional Radiology. We have created an interventional radiology curriculum for medical students and fellows and residents. And the idea of that is that anyone who can look at this book, there's a PDF online version, they can look at it, see what we do. It will be a reference for medical colleges, a reference for the students. It has barcodes, they can scan it and they can look at it and see what the amazing things that we can offer for the patients.
Wonderful. And so do you think, since we are talking about the training part, during the radiology residency time itself, we should train them to become a clinician, right?
100%.
Yeah.
100%. You know, this was said by our founding fathers of interventional radiologists. They said, do not become a carpenter, do not become a blacksmith, a proceduralist, because anybody can become a proceduralist and do a procedure. You have to maintain your clinical skills. You have to understand the disease process. You have to know how to examine the patient, take proper history, ask for the proper investigations, do the procedure, and follow up the patient after the procedure.
Yeah. Yes.
And manage the complications.
Yeah, that too. So they should be ideally posted in their first year, like how, I don't know, I was a surgeon first. I mean, I was doing my surgical residency first. Maybe that is why I had a little bit of exposure in the clinical
Yes.
side. So that is benefiting me when I am assisting cases and all in IR. So if there is any kind of complication, if the patient goes into an arrhythmia, I know, like, because I've seen in my previous residency phase few things. So ideally a radiology resident should be posted in few months in surgery, medicine, and
Yeah, I think that is right. Some people require physicians to go into training into medicine, surgery, or whatever, so that they have an understanding what medicine is. Not only just finish medical school. There are several training programs. Each one has slightly different training skill set. But by all means, there should be a rotation so that clinicians who become interventional radiologists must be doctors before becoming a procedure doing doctor.
Yeah, true. And so as a resident now, what advice you have to give me when I am looking forward to becoming an interventional radiologist in my life? So.
First of all, you have to believe in it. The future is interventional radiology, because I remember when I was a medical student, they used to say a big surgeon has a big, or creates a big scar. Then they said a better surgeon will create a smaller scar. Then the era came where they are doing endoscopic small needle hole surgery, and we are the next upgrade of that. We are the next software upgrade. So we have to convey this to medical students. We have to convey this to the other doctors, so that when they look at the future, they say, okay, this is where I'm going to be, because this is where the future of medicine is.
Yeah, true. Wonderful, sir. And is there any challenges that you're facing in your day-to-day practice when you're doing the cases at your place?
Yes, of course. One challenge is patient awareness, and that's why we have to create public awareness for the patients to understand what we do. And that involves not only the patients, but also our colleagues, our doctors that we are dealing with. One challenge is the price of the interventional radiology equipment. But people need to understand, it is true that the equipment is more expensive, but the other flip of the coin is that he is saving on pain. They are saving on staying in the ICU. They are saving on staying in the hospital. They're saving on pain medications, and they are having good time with their family.
Yeah, I know. I mean, they don't have to be bedridden for a while. They can just walk back to their home the very next day or on the same day.
Yes,
yeah.
They do the procedure,
yeah.
and they go home. Next day, they're in the coffee shop having coffee.
I know, yeah. That is something that we have to create an awareness among patients. Mm-hmm. And what do you think, creating a multidisciplinary model, we should actually encourage our colleagues, other specialty doctors, to refer cases whenever that is needed, right?
It is important, because when you discuss a problem of a patient and you have multiple doctors, each one will give his or her opinion, which means the patient will get the best of all worlds, because each will give an opinion. Then eventually the patient will get the best treatment that he will need, which can be by one clinician and sometimes by more than one.
Yes, that is true. And only by doing large number of cases, we'll be able to cut down the consumable price also.
That's true, because you cut unnecessary expense, unnecessary equipment.
Yes, that is true, sir. Okay, thank you so much for spending this. I mean, I could see from morning you have meeting sessions and everything, and you were so tired, and even after that you found out time to spend few time with me to do my podcast. I'm really grateful, and I'll be telling my colleagues there in India like, how pairs treated me. It's something any resident will be looking forward to.
I'm very honored for us to have you here. I'm also honored for everybody to come and join us in our meeting. I invite all our colleagues in India to come and join us in Perth 2026, 9th to 12th of April.
Yes.
And I'm very happy to come and visit you in India next time.
Yes, sir. Sure. I mean, you have to come down and then see
I
how
hope
things
so.
are. Yeah.
I hope so. Thank you very
so
much.
Sir.